Hello, my name is Tiara Adams, and I'm going to talk about different aspects pertaining to verbal and nonverbal communication. The goal is to learn why words, actions, body language, asking questions, and being a good listener is important when it comes to working in the dental office. Whenever you use your words, you want to make sure that you're coming across to the person that is receiving the message, making sure that they understand what you're saying. Also, whenever you're using your words, it can leave an impact on someone positively and negatively. Whenever a patient comes into the dental office and you don't speak to them or you don't tell them what is going to be done, what the procedure consists of, or you just lean them back in the chair, you look in their mouth, you're not even asking them how are they feeling today. Whenever you don't talk to your patient, that is very important. You have to talk to your patient. Whenever you do not talk to your patient, they're left confused. They don't know what's going on, and they might not even come back to the dental office that they went to before. So it's very important that you have a communication. It's very important that you communicate with your patient to let them know what is going on, because whenever you sit there and lean them back and not tell them what's going on, like I said, it leads to confusion. Also, voice quality. Voice quality, you want to make sure that you're speaking loud enough so the patient can hear you, but don't be too loud like you're screaming at them or like you're trying to come across to them as being a loud person. You just want to speak in a soft, gentle tone that can connect you to your patient, that they can understand what you're saying. Whenever you're speaking loud to your patient and they're not focusing on nothing that you're saying, whenever you're speaking so loud to them, all they're focusing on is why are you talking so loud? And they're probably worrying about other people hearing the information that you're giving them. So it's very important to make sure that you're speaking in a soft, gentle tone, normal tone, not with an attitude. And so, not with an attitude, because whenever you speak with an attitude, you may receive an attitude. So it's very important that you are speaking to your patient in a gentle, soft tone and speaking loud enough so that they can hear you. A lot of people struggle with not speaking loud enough. They mumble, and that's not showing respect, or that's not showing that you're confident in what you're talking about. And so you want to make sure that you show that you're confident in what you're talking about, you know what you're talking about, and you want to make sure that the patient understands what you're saying. Asking questions. Whenever you ask a question, you want to ask a question in a polite way. You don't want to be disrespectful. You want to make sure that you're using your manners. Whenever you ask a patient for an example, whenever you ask a patient to sit quietly in the waiting area or the reception area, the questions that you ask can either be a yes or no. It can be answered in a simple yes or no, and with a simple yes or no answer. And whenever you do that, you would ask the patient, Miss such and such or Mr. such and such, do you mind waiting in the reception area? That's the simple yes or no. Whenever you are using whenever you saying yes or no, a simple yes or no, that is a closed question. And so whenever you are using a open question, you are allowing your patient to answer your question more in depth and in detail, more than just a yes or no answer. Whenever you ask them something, they'll respond either yes or no, but then they'll either tell you more in detail about their answer. So you ask a patient, how are they feeling today? They're not going to just tell you yes or no. The question that you ask requires a more in-depth answer. So that is what you want to make sure that you do too. You want to make sure that you're asking your patient the right questions. Know what questions to ask them so that you receive the right answers. And always use your manners. Always use your manners. Okay, nonverbal communication. That could be, nonverbal communication is important because it is your body language. It's mostly your body language, your facial expressions. Whenever you ask a patient to do something, or whenever a patient tells you something, or the dentist comes and tells you something about that particular patient, you don't want to alarm your patient. You don't want to make your facial expressions or the things that you say, you don't want your body language to come across as you are alarming that patient, or they should be scared or fearful or anything, because that is why it's very important. Because coming across, having a negative body language can come across as you putting fear into the patient. Or also, your body language, if you sit slouched or you have your arms crossed, like you're not interested, you don't want to be disturbed or bothered, you don't really care about what's going on, that has a negative, it's a low level body language, or a low level nonverbal communication signal right there. It shows that you're not interested, that you don't want to be bothered, you're not open or accepting anything that is going on. A positive body language, and especially whenever you have a patient agreeing to whatever you're telling them, would be a positive head nod. You know, they are agreeing with you. They are understanding what you're saying. So that, and a smile can go a long way, and it makes your patient feel comfortable. It makes your patient feel comfortable, and they know that they are being cared for. It shows how much you are caring for your patient. Whenever you have put a smile on your face, or you're talking to them in a calm tone, and you're watching what you say to them, and your body language is, you're not rolling your eyes. Even if you are having a bad day, if you're having a bad day, you're not rolling your eyes. You still are trying to maintain your composure, and keep a positive mindset. You have to be mindful that you do have people watching you, that your patients do watch what you do and how you say things. So you have to be very mindful of how you react to certain situations around basically anybody. And also, whenever you speak to your patient, you want to make sure that you're communicating with them, but not only your patient, but you want to make sure that you communicate with your co-workers. You want to make sure that they are on the same page as you are on. You all have an understanding about that particular patient, so that it'll show that you are showing good work ethics, and that you are all on the same page, and all are on board on the same thing about that specific patient, or anything that might be going on in the dental office. So you want to make sure that you and your co-workers are communicating as well. Being a good listener. Being a good listener is important, because whenever a patient tells you what is going on with them, what they are experiencing, it is really important to make sure that you are listening to your patient. Because you want to make sure that you are grasping every important detail that they are telling you. You don't want to sit there and try to think of a way to respond to whatever they're telling you. You just want to make sure that you are listening to them, so that you can give them the best patient care that they deserve while they're there at the dental office. And so therefore, whenever you are being a good listener, it shows that you can how well you can help that person. and then you can listen. I mean, they can listen to you as well whenever you talk. That's why I said being a good listener to that patient, you'll know how to receive their message, and then you can help them, and they'll know how to receive your message. And that is really important. That is why good listening is really important, because you don't want to end up doing something wrong to that patient just because you're not listening. You want to make sure that you are giving your patient your full attention. That means that your eyes are on them and you're paying attention to every word that they're saying, so that you can fully understand and grasp everything that they're saying. So these are my reasons of why, this is my goal of why words, voice quality, asking questions, and being a good listener, and your body language, it shows why it is important in the dental office. Thank you.